Hello, all. Welcome to the third webinar in a series of trainings offered through November by the Illinois Public Health Institute through funding from the Illinois Department of Public Health and the Community Health Assessment and Planning Grant to support the Illinois Project for Local Assessment of Needs, otherwise known as IPLAN. This series covers all the requirements of the administrative code for IPLAN, and today we'll be talking about prioritization and alignment with SHIP. Next slide. My name's Samantha Lasky, and I'm joined by my colleagues Lori Call and Fabiola Gaviola, and our two presenters today, Becky McFarland with the DuPage County Health Department and Amanda Mail with the Boone County Health Department. Next slide. Here's our agenda for today. We have some interactive components, so we ask that you stay on screen with us and actively participate. We also look forward to having you hear from our peer presenters. Our learning objectives today focus on applying a community-engaged prioritization method for the I-Plan and defining alignment with SHIP in the I-Plan process. These are our typical group agreements. We generally use these to create a conducive environment for learning. Please let us know if there's any concerns or questions about these. There may be some questions that we may not be able to get to today or answer them today, but we want to ensure that we'll get those answers back to you. We also know that there's plenty of experience in the room, and we invite you to respond to each other's questions as well. Excellent. As you can see here on the screen, the requirements for iPlan submission are here and include the certification application, the electronic version of your iPlan with page numbers and a table of contents. The substantial compliance evaluation also requires you to include page numbers for IDPH's review. You can also find these requirements on the iPlan website. We're going to drop the link to that in the chat. Awesome. Now we're going to dive into the prioritization process, and I'll pass it over to Lori.
Thank you. All right. So IPLAN requires local health departments to identify 3 priority health needs from the analysis of the health status data and the qualitative data collected from the community on the health problems that are most concerning to the community. Local health departments are also required to provide a description and outcomes of the prioritization process. So you do need to describe the prioritization process you used and who was involved in that and the results of that prioritization process. Here's a few tips to think about as you're beginning to prioritize. You want to really think about your prioritization process at the beginning of your community health needs assessment because you're thinking about who are you involving, what type of process are you going to use, what type of resources are you going to need for that. It's really important to think about that early on and not wait until you are ready to prioritize. You also need to make sure you've completed all of your data collection and analysis before you begin to prioritize. And it's very important to engage the community in the process. So your community committee, if you have one, community members, but you really want that community voice represented in your prioritization process so that you are prioritizing what the community feels strongest about. You'll need to document that process and who was involved, the community members involved. And part of that documentation is listing, the names and what community they represent or what organization they represent. So at any time, the regional health officer could ask for those rosters or those meeting minutes or anything when they come on site. So make sure you have that type of documentation. The prioritization process can be done in many different ways. There's not one prescribed way to prioritize, and there's really not a right or wrong way. It's really what works best for you, and there are pros and cons to each process. So some important considerations include the number of issues that you have to be prioritized. Some processes are not really useful if you have a long, lengthy list and the number of people that you have participating in that process and the prioritization criteria that you and your community want to use to prioritize. So those are some things that you'll be considering when you're choosing a process or method. Okay. The overall steps in the prioritization process include analyzing all of your data and summarizing that and presenting that back to the community. And then choosing your three priorities based on prioritization criteria and a structured prioritization method. So, analyzing all of your qualitative and quantitative data is and summarizing that really helps inform what your potential issues are that you're going to prioritize. And it's very rare that you would come up with a list of, only 3 or 4 items out of all of that data. You generally have a list of, I don't know, anywhere from 6 to 12 or sometimes even more potential priorities. And that's where through discussion with your community, you may narrow that down a bit even before you prioritize, but that's the type of discussion that you'll want to document. So once you've identified those themes throughout your data and you've identified potential strategic priorities or community health needs, however you word that, health problems, they all really are what you're prioritizing. You will apply a prioritization process to narrow down the issues and select the number that you are comfortable with. And that's a minimum of 3 for the IPLAN requirements. Here's some potential prioritization criteria that you might consider. And these are some of the more common criteria, the potential severity of the issue or of not addressing the issue, the complexity of the issue, meaning that it requires a multifaceted strategic approach, the potential impact of that issue on your community. Does it impact a large portion of your population? Does it have an impact on exacerbating disparities? Does it impact a specific vulnerable population? Is it in alignment with the state health improvement plan? That's also a consideration that you may want to think about. You don't have to choose a priority that's in alignment with SHIP, but that is sometimes the prioritization criteria that people use. How important is it to community and community members? Did it really surface to the top in that qualitative data that you collected and the community input data? Are there community strengths and assets that you can leverage? So this is just some prioritization criteria, and I'm sure that you have others. So if you are at your desk right now and you can open up your chat box, you can find your toolbar by hovering around and open that chat box, list any additional criteria that you've used to conduct prioritization of your health problems, strategic issues for your IPLAN. So what do you consider when selecting priorities? What's that prioritization criteria? Go ahead and put a couple ideas in the chat. And Samantha, I'm not seeing anything on my end.
They just started coming in.
Okay.
Um,
Thank you,
so we
Ryan.
have health equity, resources. Are there existing effective interventions and opportunities to partner with the community to address this issue? Is there funding available to address this issue? Ryan said feasibility of addressing the issue. We have alignment with other communities, addition like strategic plans, resources in the community. These are some really good responses
Great.
and some
Yeah.
thumbs ups and some hearts and things like that.
Fantastic. All great ideas. Thank you. We'll just keep moving forward here. We're going to review a few prioritization methods with you. This is not an exhaustive list, but some of the more common prioritization processes. So I'll turn it to Samantha to kick us off with those.
Awesome. We want to hear, to begin with, a poll from you all to hear about the prioritization processes that you have been using. And we want to make sure we hear from everybody. So Fabiola is going to pop a poll onto our screen, and our poll is asking you what prioritization methods have you or are you current have you used previously or are you currently using? And you can select any. If you've done multiple cycles and used multiple processes, select that. If you've done none of them, that's cool too. We just want to hear from you. If you're not sure, that's fine. And if you've done one that's not listed here, feel free to put that in the second question there. If you've selected other, please describe. So we're at about 62% response rate, a little more than half, but we'd love to hear from a few more folks. This is awesome. Okay. So, oh my gosh, we're getting almost 100% response rates. You love to see it. So it looks like a majority of what we're seeing, a lot of folks are using multi-voting method. We have quite a few right behind that using the Hanlon method. Also, quite a few not 100% sure. Some using strategy and nominal, and a couple using none. And then I see we do have oh, never mind. Okay, awesome. Thank you so much. We love to see it. And we will move on. So some of this might be review for some of you, and some of you might be hearing about a new method that might apply to your group. So we'll move on to the next slide. As we said, there are several methods for prioritizing, regardless of the prioritization method used. The result should be a consensus-based list of priorities that are grounded both in data and input from community and partners. The prioritization process should be transparent and reasonable, as well as easy to understand. It should be incorporating objective criteria, as well as an analysis of the available data and community perspectives. It's important to consider local health department and community resources when selecting the prioritization method, like we saw with some of the folks with their criteria. All health problems should be evaluated using a clearly defined method. Local health departments and their partners should be careful to consider and select the approach that best fits your community and context. On the following slides, we'll describe some of these methods that you see on screen, and keep in mind that a combination of these methods may be used in the same process that you're doing. Next slide. The first one we're going to be talking about today is multi-voting method. Multi-voting is a method typically used when you have a very long list of health problems and you need to narrow it down, as you can see as on the example on the right-hand side. This process allows a problem that might not be an individual's top priority, but is still an important priority to all, but is still important to all to become a priority. To conduct multi-voting, the local health department uses the themes from the summary data and presentation as a list of health problems, as you can see in the left side of the table. From there, each participant chooses their highest priority problems. A maximum number of votes is typically established based on the amount of people in your room. And in round one, the participants vote for their highest priority. Then you update the list and narrow it down to the problems with half of the number of votes available for the participants. And then in round two, you vote for the highest priority again, as you can see here. And then you cross out the ones that aren't working and you go on to the next round. Then in round three, you repeat that step until the list is narrowed down to three priorities. And the color coding for, I didn't write this down, but the color coding is for each round where they were crossing off in the example, which ones did not get the highest numbers. Next slide. Oh, one back. There we go. The next method is the nominal group technique, which uses group input and information exchange through brainstorming. Nominal group technique is really helpful for when multiple perspectives should be taken into account, and it allows for equal say among participants. The initial exchange of information is not evaluative. So we're not evaluating, we're brainstorming, and all ideas are equal and valid. In the next stage, participants apply evaluative thinking after this first nominal group process. Sometimes the process is used with the multi-voting technique, where nominal group can be first used to brainstorm ideas and create a broader list, and then multi-voting can be used for the evaluative portion to narrow down the list. These are the steps in this process. So first, you establish a group structure with at least 6 people and a moderator. Then participants begin to silent brainstorm, and that's a really important part of this. From there, they generate a list in a round robin fashion with one idea per participant without evaluating those ideas, and repeat until all of the ideas are listed from everyone in the room. From there, we'll simplify and clarify with the group from feedback on how to group the items. Then have a group discussion on how the items compare to the criteria. Then we'll have participants do anonymous ranking of all the health problems and calculate the scores. This is the evaluative portion. And finally, you repeat as needed until you have at least your 3 priorities. Next slide. And if anybody has any questions about any of these prioritization methods, feel free to drop them in the chat as we're describing them. Right.
Thanks, Samantha. Next is strategy grids, and strategy grids are useful when groups have two really important criteria that you're addressing. And keep in mind, any of these tools can be used in combination with each other. So maybe you've narrowed the list down to 5 and you want to narrow it down to 3. So you might use a strategy grid. And so you might choose some really important criteria to you, like feasibility and potential impact or need. So you can see the example here on the screen. If there are limited resources and limited capacity and you want to focus in on priorities that you can best address and are really the greatest community needs, this is an example in a strategy grid that you're doing of a 2x2 here, and you're looking at you're looking for high feasibility and high need. So to use this, you select the 2 criteria that are most relevant to your community, and like feasibility and need in this example. And then you create a grid like you see on the screen here and assign 1 criteria to each axis with high and low arrows and label those quadrants. So the next component is that you're going to really physically place the different health problems that you have in your list in the quadrant based on group discussion. So again, this is a combination of group discussion and using this tool to place the issue where it belongs. And what you'll be looking for is things that are in this quadrant of high need and high feasibility, or at least, as much as possible. That's where you'd want to be. That's where you'd be choosing issues from. So this is a really discussion and consensus-based type approach. And I wanted to just ask, what other criteria might you use in a strategy grid? So this one is using need and feasibility. What are some other 2 comparisons that you might use? And go ahead and pop that into the chat.
We haven't gotten any responses yet, but some additional ones that some people like to consider are magnitude and changeability. I see in the chat availability versus availability, community buy-in. We also have like severity and feasibility. Another person put in the chat economic cost. Awesome. And then one that is often used as well is community priority versus data priority.
Thank you, Samantha. All right. Another tool that is often used is a prioritization matrix, and this is ideal when considering a large amount of criteria, provides a visual method for prioritizing. So you're going to create a matrix. So something in Excel would be perfect where you're having a table. You'll list all the health issues in the vertical and then all the criteria you want to consider across the top in different columns. You're going to rate against specified criteria using numbers. It might be something as simple as this scale you see on the screen here of 1 is criteria is not met, 2, the criteria is met, and 3, the criteria is met very well or extremely well. You could also use a high, medium, or low, something that is meaningful to you and your community and that everyone understands how you're using that scale is really important. So you're going to weight the criteria by multiplying the rating with the weight of the criteria in each cell of the matrix. And if the criteria have an equal level of importance, this step can be skipped. So sometimes, all the criteria or certain criteria is weighted the same, but you might decide that feasibility is really weighs more. Or you might decide that it's a community need and that weighs more. Whatever it is, that's how you're going to determine by your community and through discussion with those who are participating in this, how they want to weigh those different criteria. Finally, you're going to calculate the priority scores by adding the scores across the row and then ranking based on those scores. So here's a picture of what that might look like. In this particular example, we just had 3 different prioritization criteria with importance to the community, feasibility, and potential impact on disparities. And you can see the different scores here of how, or the different weights here of how these were weighted. And then they also assigned a numeric value to each criteria for each health issue and then came up with a total score. So that's a really quantitative method and visual as well. And the next method that is commonly used that many of you said you use is the Hanlon method. And we have Becky on to explain this. So I'm just going to show you this screen as a reminder. In the Hanlon method, which is also it's been used for many, many years. It's the method that is recommended in the Apex PH manual, but it has also been widely used by health departments who use MAP as well. But you're going to first rate against the criteria on a scale of 0 to 10. Um, and it's the similar criteria that we've talked about. Then you're going to apply the Pearl test to screen the health problems based on feasibility. And the Pearl test looks at is this problem suitable, propriety, economics, does it make economic sense to address it? Acceptability, will the community accept a program or this type of solution? Is there R for resources and legality? Do the current laws allow a program or activity like this? Of course, if there's anything that's a no answer in those questions, you're going to eliminate that issue. And then you're going to calculate the priority scores and rank the issues. So I'm going to turn it over to Becky with DuPage Forward to tell how they've used this method. Becky?
Lori. Yes, my name is Becky McFarland. I'm a community initiative supervisor at the DuPage County Health Department. And I'm just going to give a little bit of context on Impact DuPage, which is our CHA CHIP collaborative, before I get started. So this is just our vision and mission. So to give you an idea of who participated in our prioritization, this is just a list of all of the organizations that are on our steering committee. And then we also had a data committee. The MAP 2.0 calls this an assessment design team, but we just call it a data committee. And so this group helped us come up with what criteria are in our Hanlon method and kind of how our prioritization was presented to the steering committee. So what we did after we had our data collected is that we had 23 topics. So that image on the right is sort of how we laid it out. So we had a topic, we had a list of the quantitative data sources we had, any qualitative data we had, if there were disparities, if we had a breakdown of those, and then just like a quick narrative if there was something to capture, and then understanding like the existing resources we have in the community to address that issue. And so we gave the steering committee a week or two to look at this document. It ended up being like, it was like 65 pages long. But then having them use that information and eventually what our Hanlon criteria method would be, or our Hanlon criteria would be to rank the topics, rank their top 10. So we used a platform called Alchemer to have them pick their top 10. And then once we had the top 10, which they're listed on the right, what our top 10 ended up being, we made issue briefs. And so we had like an overview of whatever that issue was, why it matters, sort of any key findings from the assessment. If there were disparities, we could call out any strengths and opportunities related to that topic, what current resources we had to address that topic, and then potentially considerations that could go in an improvement plan. So again, giving them a week or two to sort of sit with those issue briefs before we did our official Hanlon method. And then we actually pulled our steering committee together for a special meeting to do this in person. And we used a modified version of the Hanlon method. We had selection criteria around impact on the community, outcome opportunities, and resources, and gave them the prompts to sort of think through. So the image on the right is a screenshot of the actual Excel spreadsheet that we used. The column that's hidden is the steering committee member's name. So they all basically had like a shared Excel spreadsheet. They had the 10 issues listed and they would vote next to their name and just rank 0 to 10. And then we used a pivot table to basically say like, okay, access to healthcare, like that's all adding up to whatever number. And we didn't weight any of the criteria basically because we sort of modified them anyway. And so we took the top. What ended up happening though is, you know how you have to adjust in real time, is that we had 5 priorities that were almost like tied for those top spots. And having had several cycles, we kind of realized we really only like to have 3 priorities. It's only feasible to really do 3. And so if you go to the next slide, we ended up we had a discussion where we did some of those like Pearl test things. We talked through, you know, kind of the pros and cons of those top 5. And then we actually ended up having to send out another vote where people would, again, we did a ranking. So they could pick, you know, highest to lowest what they wanted to do. And so you'll see there again, this is a screenshot of our results from Alchemer about how the 3 priorities that ended up being our priorities sort of won that vote because they had the highest score. So we ended up having substance use and mental health, access to healthcare, and maternal and child health for our priorities for through 2030. And that was, I think, my last slide.
Thank you so much. You did such a good job explaining how you use that. So we really appreciate that. Do you have any follow-up questions? I'm sure Becky would be happy to answer those. Thanks so much.
Awesome. Thanks so much, Becky. Next slide. The final piece that we're going to explain for prioritization is how MAP 2.0 conducts their prioritization process. So they have a longer title for it, but they conduct the process in a similar way to engage your community, summarize data, and identify themes. MAP 2.0 is very intentional about working with partners to conduct these steps, and we definitely recommend that as well. Local health departments, first thing, work with your community to conduct these steps. Then use guiding questions that you developed prior to conducting the assessments to summarize and present the data, answer those guiding questions. And then from there, organize the themes of these data under the certain categories. And these categories include systems of power, privilege, and oppression, social determinants of health, health behaviors and health outcomes, and community strengths and organizational capacity. From there, local health departments will create issue statements that identify and summarize why and how the issue occurs, the severity, and its outcome and impacts, and then share those findings with the community. Once you share those findings with the community, your partner should meet to discuss the topics, develop issue profiles, and conduct a root cause analysis. You can use, just like what we've been describing, you can use any prioritization method in conjunction with how MAP 2.0 triangulates the data, identifies themes, and develops issue statements. This is a visual representation for MAP 2.0 on how they do that. We'll go more into depth about this process at our in-person MAP 2.0 training in September. If people are interested in signing up, we have 30 spots in total. Next, we're going to hear from Amanda Mail on how Boone County has used their process to prioritize the Boone County issues. And I'll pass it over to Amanda.
Thanks, Samantha. Hey, everybody. Amanda Mail here at the Boone County Health Department. I'll be pretty brief. We use a prioritization process. We've used this the last two cycles of MAP. The last cycle in 2023 was our first cycle doing MAP 2.0. So we used the same prioritization process when we used MAP 1.0, and then we applied it also to the new MAP process and found it to be pretty helpful. So we, like DuPage County, we had a steering committee, and then we had some different partner meetings where we conducted our three assessments that make up MAP 2.0. But one thing that we also did with our prioritization process was we included some of our outreach methods in that process. So we had focus groups, surveys, social media, and Facebook Live events. And then we had a WIC and community meal event where we had community participation. And we actually, at several of these events, we actually distributed our prioritization process via survey and collected data for the prioritization process, not only from members of our steering committee, but also from members at large at the community. So that was an interesting new piece that we added this time that was extremely helpful. And the methodology that we have used the last two MAP cycles is the full analytical criteria method to rank health priorities. And that comes from Lean Six Sigma, if you all are familiar with that. I did include the link. Happy to talk to anybody offline after the meeting if you'd like a crash course. Our director of operations is the one that oversees this process. So she uses a spreadsheet similar to what Lori Call was explaining, with columns and rows and pivot tables to determine the ranking. In our 2018 IPLAN, we did weighting, and in 2023 we did not do weighting, which I'll explain in just a minute. So the six emerging themes that we prioritized against each other in this survey were behavioral health, access to care, food security, maternal child health, health equity, and resiliency. So we can go to the next slide. And so just here's an example of sort of how we had one of our focus groups conducted, how we advertised for it. And like I said, we used this ranking tool at several of our community outreach events that were tied to our MAP process. And we were able to tabulate information from members at large at the community who did the ranking worksheet, or if they were on our Facebook Live, they were able to do like a live Survey Monkey tool that we facilitated in the moment of the live event on Facebook. Next slide. Okay, so I sort of explained how we structured it. The way that our ranking shaped up for our 2023 IPLAN is listed here, with behavioral health, access to care, food security, and maternal child health in that order. One of our key distinct differences this time with our cycle in 2018 was we used less important, equally important, more important as our categories for ranking. And 90% of our responses this time around for our last IPLAN were marked as equally important. So those answers got thrown out and we didn't end up weighting our ranking process because we didn't have enough data to use because so many people were equally important. I guess one thing is it shows that everybody felt that all of the issues were super important, and I'll explain how we handled addressing all 6 of those themes in just a minute. But that was a key difference between our 2018 IPLAN and our 2023 IPLAN. And so I think, Samantha, did you put in the chat our little worksheet?
Yes.
Super simple, easy to explain, we find, not only to like community leaders or community partners, but also to facilitate in a public setting with people of, you know, all different backgrounds, different reading levels, different abilities, right? Just making sure we can include members of the community. The biggest thing for us that we find is important to explain is marking everything as equally important doesn't necessarily get us the comparison that we might be looking for. So we really encourage people to think deeply, like really think hard. Do you think behavioral health is less important, equally as important, or more important than maternal child health, for example? So feel free to download that worksheet, beg, borrow, steal it, call me after this call and say, hey, can you walk me through something? I'd be happy to do that. Next slide. So what we ended up doing, which has been extremely helpful, is we selected 3 health priorities: behavioral health, maternal child health, and food security. And then we use a lens approach. So we take our action plan and within behavioral health, maternal child, and food security, we have goals and objectives that are specifically tied to health equity. So because that theme emerged as something very important as well, we decided to utilize it as sort of a cross-cutting factor across all of our health priorities. So in our goals and objectives, resiliency, access to care, and health equity are baked into those priorities. So that was the way we chose to incorporate all 6 of those emerging themes, because this time around, people really struggled to say which one is more important than the other. We got a lot of feedback like, these are all important, we should work on all of the things. And our county, similar to DuPage, has learned that doing more than 3 is just not in our bandwidth, and we're not able to really focus on our activities. So if you read our IPLAN, you can learn a little bit more about how the lenses apply to our work plan with our goals and objectives, which has been helpful, but that's how we incorporated all of our themes. And we have some existing coalitions that are working on these areas in our community anyway. So we were able to roll those 3 health priorities into these 4 groups and then use the themes or the lenses as sort of those cross-cutting factors across all of the priorities. Next slide, or maybe that was the last slide. We made it. That's all I got for you, Samantha, unless there's questions.
Thanks, Amanda. Thank you both to Amanda and Becky. Becky, I love to see the issue briefs and being adaptable to the process. And of course, with Amanda's work, it's so cool to see the community engagement, that level of community engagement, and getting that information from broad perspective of people definitely makes a big difference in leveraging existing resources. So thank you both so much. That was awesome. Next slide. And I've seen a lot of claps and thumbs up. Cool. Now that we have walked you through each of these methods, based on what you've heard, which prioritization process are you most interested in exploring or trying out? And you can choose multiple if you'd like. And if there's another one, like the Lean Six Sigma method, feel free to click other. Awesome. I'm loving to see all the quick responses. This is great to see. Maybe a couple more people. Okay. So it looks like awesome. I'm seeing a lot of folks still loving the Hanlon method, followed by multi-voting and the prioritization matrix both being really high, MAP 2.0 being really high. Um, I'm really liking what I see and a couple people choosing um, Six Sigma as well. So thank you all so much.
I would just say one more thing. Like if you're a smaller health department, which we're smaller, and you just don't always have the bandwidth, like, hey, we've got a lot of staff that are super savvy in Excel and know how to do pivot tables. And if it feels overwhelming, like seriously, just reach out to us and we'll give you our spreadsheet as a template. We'll teach you how to do it. It's pretty easy to learn, but it helps if like a peer explains it to you. Sometimes reading Lean Six Sigma is a little overwhelming. And so just let us know, like we'll give you all of our materials. Like it's not hard, but it can be a little overwhelming if you don't have like a good example from the field.
Awesome. Thank you so much. And Fabiola, can you drop Amanda's email in the chat?
Yep.
Thank you. Awesome. Next slide.
Becky had a great comment too. For
Oh, yeah.
a lower tech method, you can't go wrong with sticky dots and counting those. So I 100% agree, and I miss being in spaces where we can do those things. So
We love sticky dots. Awesome to see. Oh, next slide. Great. So, in part of this and what we are talking about, the next things that we talk about that hoping to hear from you all as well at the July training is where we'll describe the next steps of this process, including conducting a root cause analysis, identifying the factors that influence the problem. We'll share some methods for root cause analysis, like the 5 whys and the fishbone diagram and the health problem analysis worksheet, which describe the risk factors and direct and indirect contributing factors. So make sure to be at our July training virtually. Awesome. Now we're going to be talking about alignment with SHIP. The IDPH, the State Health Department, is also required to conduct a state health assessment and state health improvement plan, otherwise known as SHAW and SHIP. By law, every 5 years, just like the Illinois Local Health Department IPLAN requirement, local health departments should review the SHIP or Healthy Illinois for comparison and alignment. Next slide. As part of the requirements for the administrative code, local health departments must include in their I-Plan report that they reviewed the SHIP and describe the alignment and differences between the SHIP priorities and their local community priorities. Next slide. To break it down a little further, as part of the assessment, Illinois Department of Public Health reviews the priorities selected by each certified local health department in their own I-Plan and incorporates this information as key data inputs in the state health assessment. In turn, local health departments are expected to review the current state health improvement plan during their I-Plan process, examining the state's priorities and the way local priorities do or do not align with those at the state level. As part of the requirement, local health departments should not just say, yes, it aligns or no, it doesn't align. Local health departments should instead note and describe areas of alignment as well as areas of divergent and note the rationale or describe the differences in the community health needs assessment report plan of portion of the report. SHIP may also be a resource for potential strategies when addressing the same priorities. Next slide. I'm also really excited to share with you another project that our team is working on with IDPH. This is really cool work. IDPH is currently in the implementation phase of Healthy Illinois 2028, our state health improvement plan, where they're building an implementation network and disseminating an inventory. The inventory is an annual request for information sent to state and local organizations working on SHIP priorities. It asks to describe the respondents' current work aligned with the 5 priority areas, the goals, objectives, and strategies. And the inventory collects progress updates, barriers to implementation, and success stories that illustrate real world impact. The inventory will work to build a compilation of efforts aligned to the SHIP to coordinate and amplify work that's already happening across Illinois and inform the next shot in SHIP. Next slide. Awesome. So the inventory has been sent to state agencies working on SHIP priority areas, all local health departments across Illinois, and community and nonprofit organizations. Your administrators have already received an invitation to respond to this inventory. They can share the link throughout your health department or with other partners also working on any of the 5 state health improvement plan, Healthy Illinois 2028 priorities. The inventory responses will also populate a public-facing SHIP implementation dashboard, which we're really, really excited about. Next slide. There's a lot of notes, so I'm not missing anything. So currently we have a public-facing dashboard for Healthy Illinois 2028. The current data in the dashboard was collected in 2024 and is live, and the link is dropped in the chat by Fabiola. 2026 inventory data collection will be used to update the dashboard later this year, which we're really, really excited about. The dashboard will track and visualize progress across Illinois towards each of the 5 priority areas, as you can see on the screen, helps partners see how their work connects to the broader SHIP effort, and serves as a shared tool for all. Local health departments will be able to use this data as a reference for their work and see how their IPLAN priorities align with the SHIP priorities. So it'll be a really cool and useful tool for all local health departments. Finally, we would like to share an example from the Iroquois County Health Department, or 2 examples actually. The first example from the Iroquois County Health Department. What they did is they demonstrated their review of the SHIP by listing the 5 SHIP priorities and noting the relationship to Iroquois County, as well as referencing local data and similarities between intended state and intended local goals. For example, the Iroquois County IPLAN report noted chronic disease as a SHIP priority and explained, and you can see the quote here, this is directly from their IPLAN. Cancer and other chronic diseases ranked 4th in Iroquois County's community themes and strengths assessment. Combating chronic disease with education, community clinical linkages, and the promotion of a healthy lifestyle choices is a main priority for Iroquois County. So it can be as simple as that and describing the similarities based on the SHIP data and what's happening in the SHIP and what y'all are seeing in your own IPLANs. Another example, and this one's a little bit longer, so I may paraphrase. Um, but the 2022-2027 Skokie Community Health Improvement Plan included the following statement to demonstrate review and alignment of the SHIP with their local plans, their priorities, behavioral health, maternal and child health, and plans that complement each other. Skokie's Health and Human Services CHIP shows alignment with 2 of the priorities outlined in the SHIP of Illinois. They both share a focus on addressing behavioral health, and the respective goals complement each other in this regard. Maternal and child health emerges as another priority where the 2 plans align. SHIP aims to support healthy pregnancies and improve birth and infant outcomes, which complements Skokie's goal of reducing the percentage of pregnant women who do not receive timely prenatal care. So it can be as simple as saying, this is what SHIP is aiming to do, and this is what we're aiming to do, and we see alignment there. If you don't see alignment and you've chosen strategies that are not the same or you've chosen priorities that are not the same as the SHIP priorities, that's okay too. You would just describe that in your IPLAN report and say, our priorities are not the same because this is what we've seen from our data and this is what's important to our community. And that's totally fine. Next, next slide. Does anyone have any overall questions, comments, feedback, thoughts regarding either alignment with SHIP or prioritization? And Fabiola, Lori, did you see any questions that we should be discussing here in the next 5 minutes?
I haven't seen any that haven't been addressed. One was about just getting started on an iPlan. And there
Mm,
were a couple of great comments from Amanda and Becky. And really, if your iPlan's not due until August of 2027, even if your health department's, well, especially your health department's small and you have limited resources and capacity, it's a good time to start thinking about what process you're going to use and what resources you might need to plan for that. And, we have been going through the process of the IPLAN process in step by step in the training. So this is the third training, so you can review those and just see what's needed for the assessment. But just getting started, and we also have technical assistance that Samantha's going to talk about here, so that can help inform maybe some of your decision making too.
Yeah. Thanks, Lori. Um, oh, I see a question coming in. Do you all have an idea on how long each step in the I-plan process takes? For example, does the prioritization/assessment take the longest?
I'll let other folks answer because even though we've done this many times with health departments and with other groups, I'll let the health departments answer because you have a lot of experienced folks here.
Mm-hmm. And feel free to unmute as well if anyone would like to answer that way. And I see Amanda says
I
that's a tough one.
I was gonna say, like, I think if you've seen one you've seen one Like, so I think it's more about thinking through, like, do you want to do focus groups? Do you want to use the Healthy Illinois survey or do your own survey? Do you want to, where are you collecting your quantitative data sources? Do you have an epidemiologist or like a college to help you? Like, so thinking through each piece of the assessment, like what your local health department wants to prioritize as part of that, based on how long you have and what resources you have. I think that's like you almost have to like work backwards from like your deadline and then figure out kind of how you want to handle each piece of the assessment.
Yeah, I like that answer, Becky. This is Amanda. We use an internal team. I do not believe in locking any staff member in a closet and making them do IPLAN by themselves. Like that's the meanest thing an administrator could ever do. I know sometimes that's the only option depending on what your situation is, but we have a team and we have a strategist, staff member who's an infrastructure strategist, and she's kind of the key champion of the project, but there's like 5 or 6 of us on the steering committee. And one of the first things we do when I mentioned in the chat that like we need several months of planning, we do what Becky just said. We like chunk out the pieces and we're like, okay, if we're going to do this community context assessment, when do we want to do it? How long do we realistically think it's going to take us to put together if there's going to be a survey, to distribute it, to collect the responses, and we literally granularly go through everything. We create like a tentative timeline within that 12-month period or that 9-month period. Sometimes we use a Gantt chart or some type of tracking tool, like who's assigned to it, how long is it going to take, what are the components, and we meet like weekly or every other week, and we're just ticking down the list, like, okay, who put the survey together, okay, who contacted the church for the focus group, okay, who put the partner list together, who's getting the food ready for, and we just tick down the list. That's the only way we've learned over the years to do it, where it's not stressful and it's actually a collaborative teamwork process within our department.
Yeah, this is Erin Olson from Knox County, and I just did ours for the first time. I've been here for 24 years, but I just did the IPLAN for the first time, and I started about 2.5 years ago with the process of working with our hospitals, but then that timeline, and that's how I did my timeline backwards, kind of like you said, Becky. That was the easiest thing for me to do, and I did it like in 3 to 4 month periods of putting each thing in. But I would say for us, with only 2 or 3 of us kind of working together within the building, it was about 2.5 years.
And I will say also, I've worked with a group where we've been able to complete it in a really aggressive timeline in 6 to 9 months, which can be challenging, but it can be done. And I think about, the data collection and collecting all the data is unfortunately, or fortunately, I don't know, but I think unfortunately where a lot of time gets spent, because people do get into communities want to know more and more and more. Well, what about this indicator? Well, what about this? What about this data source? And so I think I've said this before, you can get into this analysis paralysis where you just keep looking at data, and at some point you have to, say, these are the boundaries, or these are the priority indicators we're going to look at for the data in the 7 data groupings, or in the map assessments if you're using map 2.0. This is the boundaries for which we're going to collect data. We only have resources to do this many focus groups, or to survey for this long. Um, because people really do spend a long, long time in data collection. And then where we really want you to, hopefully have community spend the time is really exploring that data and what's the data really telling us, and creating plans, choosing priorities and creating plans, really spending the time in planning to address those priorities so that you can leverage existing resources, and really think about how you could actually implement something if you're really strategic, and take the time to inventory all the existing resources and see what you can build off of. So, you know, I think somebody said it's the ubiquitous, it depends answer, and it really does depend. Um, but you can also, if you're using the data in iQuery and you're limited on what you can do, and your local resources, you can have set a definitive step of, we're gonna, collect some community data, and we're also gonna use the Illinois Healthy Illinois survey, and you can really be more limited in your data collection, or something like that. So feel free to let us know if you want to talk through some of that, or reach out to some of your colleagues here who've been already a great help.
Thanks, Lori. Thanks, everyone. These back and forth, these comments have been really great. Like Lori said, we have limited technical assistance. Fabiola already dropped the link in the chat if you'd like to apply for that. We can support on topics related to your community health needs assessment, your CHIP, your organizational capacity assessment, or your strategic plan, as well as the IPLAN report itself. So let us know. Apply for technical assistance if you'd like some support. Next slide. We also have our upcoming training. So our next training session will be on the Community Health Improvement Plan report introduction. So all of the things in the beginning part of your Community Health Improvement Plan, as well as description of the community participation process. But this is community participation specifically in the Community Health Improvement Plan phase of your work. We did one a few months ago for the CHNA. Now we're doing one for the CHIP. And Fabiola dropped the link to register for the series if you haven't yet. Or if you want to share it with your friends. And finally, we are really excited to be able to share that we are we're presenting a MAP 2.0 training. This is a specific training for adapting MAP 2.0 for the IPLAN. This will be in-person training from September 22nd to September 23rd. Both all-day trainings, and it'll be held in Springfield, Illinois. We're hoping to make it, a very central location to the state. Registration will be limited to 30 people, so register soon if you can. And note that IPHI unfortunately is unable to provide lunch or travel accommodations, but we will give time for lunch and things like that during the training. And Fabiola has dropped that link in the chat as well. And finally, we appreciate you coming and joining us today. This has been really awesome training. We're going to flash a evaluation on the screen. Before you leave, please and thank you to help us do this work better and to get some evaluation data. We would love to hear from you all. So before you hop off, if you could take 1 or 2 minutes to share your thoughts on this training. It's like a 30-second poll. And then once you are finished, you're welcome to hop off. If you have any other questions, feel free to drop them in the chat or on mute. But thank you all so much. This has been such a great training today, and we're so glad to hear from you all.